help in a course in persistence. These two gentlemen have figured it out. And so, yes, when I got out of the car, I found John outside there waiting, and it was, you know, just to ensure that I really was here. So, so yes, I'm here, and I'm really, really happy to be here. I'm extremely proud and really humbled to be back in Africa, and just seeing how the both the programs and the research community has blossomed. So I'm really honored to be asked to give this keynote speech at this inaugural international conference on NTDs in Africa. I want to start by thanking the Ministry of Health and KEMRI, to also thank the program and ARNTD for their vision in organizing this groundbreaking event. I also want to thank all of you here today, and I look around, I see policymakers, implementers, researchers from different disciplines, students, funders, and other stakeholders who work on NTDs in Africa. It is in this spirit of collaboration which I believe defines our NTD community. Your contribution is broad, your productivity is astonishing. As I myself reflect on the journey that led me to becoming the director of NTDs for WHO, through my time in NTD research and program manager, I am inspired by how far we've come and by the progress we have made as a community, as regions, and as a continent. In this room is a critical mass of NTD, African NTD leadership, to move NTD programs forward on the continent like never before. Programs have matured, and truly, I see the only way is up. This gives me great pride, thanks to those who have invested in building the capacity of African leaders, of these African leaders. These investments are slow, but eventually they do pay off. There is a Swahili saying, ukiona vimeelea, vimeundwa. Ukiona vimeelea, if you see them built, somebody actually built them, somebody invested in them. Over the past decade, and with the help of a whole host of dedicated partners and donors, we have seen stunning progress in many countries. Scale-up of control and elimination programs has already led to more than 1 billion people being treated in 4 successive years from 2015 now to 2018. That is quite an achievement. As we all know, Africa carries almost 40% of the worldwide burden of NTDs. A total of 44 African countries have widespread occurrence of at least one PCNTD, and 42 countries at least 2. These diseases can ravage entire families and communities, causing debilitating physical and mental symptoms, terrible disfigurement, and long-lasting disability. And because they prevent people from going to work and children from attending school, they have an enormous impact on financial stability and educational attainment. We are making impressive strides in sub-Saharan Africa. Last year, Togo eliminated lymphatic filariasis as a public health problem, and Ghana eliminated trachoma in May of 2018. As scientists, partners, and community health workers continue to come together to aid and protect the most vulnerable members of our communities, we are poised to reach similar milestones in other nations throughout Africa. And your leadership is fundamental in making this happen. Progress is also being made in addressing NTDs, which require affected individuals to be managed in an integrated way. In February 2018, Kenya became the 41st country out of the 47 member states in the African region to be certified free of guinea worm disease. Leprosy is being eliminated as a public health problem, and human African trypanosomiasis is moving steadily towards elimination. This is all such inspiring and amazing progress, and has only been made possible due to the collaboration of so many people across so many African countries. But just as our deep commitment to the work we do has enabled us to achieve these successes and to be justifiably proud of them, So the same commitment must now drive us forward as our community arrives at a crossroads. As we are all aware, NTDs are diseases of poverty, which can only mean that our task is social as well as medical. This means that in order to meet the targets we have for eradicating, eliminating, or controlling specific diseases, we need tools that will also enable us to measure the equity of our interventions as truly as they measure clinical impact, in order to ensure that the impact of the interventions is felt everywhere it is needed. This intimately links our work to the dramatically changing world in which we all live, the developing consequence of climate change, and are starting to be felt in large parts of the world, and here in Africa particularly. And it falls to us to understand and take on board the impact of such changes on NTDs and the impoverished, resource-deprived, and conflict-ridden communities here in Africa which have to bear the burden. It is my considered belief that a collaborative focus is essential if we are to take the next phase of our work, the gains we have managed to bring about in these previous periods. This means bringing various aspects of our workflow together to form well-functioning, integrated health systems that work for all the populations in the urban and rural areas alike. But it also means maximizing opportunities not only within, but between our different countries as well. Diseases respect no borders, and of course, our approach to NTD control and elimination must take that into account. As we move closer and closer to the last mile, cross-border issues represent populations that, unless they too benefit from increased efforts, may put our successes at risk. I know that efforts are already being made out to reach and address these populations, but our successes need to be on a regional basis. We may have eliminated a disease in one country, but if our neighbors on all sides remain endemic, then is our success real? This requires that we not only take steps such as synchronizing MDAs to avoid duplication or missing communities, but that we also collaborate and share laboratory capacity and expertise, along with resources and technical capacity. As we move further towards elimination, it will also be about working together to ensure robust cross-border surveillance. I also passionately believe that for real and sustainable change of this kind to come about, countries must be allowed to be at the driving seat and also do it together. At this point, I would like to sincerely thank ITI, who have been holding cross-border meetings for quite a while. They have encouraged these cross-border meetings were predominantly for trachoma, but have gone on to encompass other NTDs. So I feel that this is the way forward. We need to move forward in this direction. So my keynote would not be complete if I didn't talk a little bit about our new roadmap for NTDs for 2021-2030, which was completed with your help, your precise knowledge, and invaluable experience. It was important for us that the new roadmap recognize the challenges and successes of the previous roadmap by making our targets for 2021 and 2030 more ambitious without losing sight of the need for a basis in evidence and pragmatism. As always, implementing these actions that will enable us to achieve these goals will require close participation and collaboration of all involved, from heads of state to scientists to project teams to dedicated partners and country health workers. In short, all of you who will work with us to implement the strategies the world over. Those of you who will help us, I hope, to cover every last mile. I mentioned the importance of country leadership and ownership earlier, and this new roadmap has been developed to ensure with a phased transition towards increased country ownership, leadership, and support for NTD programming will rightly place NTD control within the associated agendas of universal health coverage and primary health care. The 2030 roadmap will also be accompanied by 2 companion documents. The first is a sustainability framework that will trace, guide, and promote national health system capacity and commitments, and promote and highlight the support and commitment of governments, donors, and private sector partners to maintain the provision of NTD interventions at levels that will continue progression towards the roadmap goals. So this is a step-by-step looking at how we are, our road to sustainability step by step. The second is an investment framework to reaffirm the case that cost-effective and affordable interventions exist to tackle NTDs, and that these investments in critical gaps will enable countries to achieve the targets set out in the roadmap. In practical terms, that means our new roadmap is a key element in the UN Sustainable Development Goals and the global vision required to promote primary health care on the journey towards universal health coverage. It should also serve as a reminder to us that the only focus of NTD programs is people themselves, and that NTD interventions can act as a gateway to UHC, which will allow people everywhere to access quality care. After all, NTD programs treat billions of people, train millions of health workers and community volunteers, and provide vital services to people who live far beyond a health facility, beyond the end of the road. The success of our new roadmap will depend on teams and partnerships and cross-country collaboration. I look out at this room this morning and see a wealth of experience, expertise, and enthusiasm. I see all the ingredients that are needed for the success in overcoming the many bumps in the road ahead. We have a roadmap which leads us towards sustainable change, change which will be felt in vulnerable communities in all our countries. Together, we can ensure that children have health to learn and that their parents have health enough to work and prosper and provide for their families and community. If the picture I've painted seems famous African saying, if you want to go far, if you want to go fast, go alone. If you want to go far, go together. So I'm going to say unity is strength, disunity is weakness. If you want to go far, go alone, fast, go alone. If you want to go far, go together. And we'll be well encouraged today to remember those words and those sayings, because we really need to move fast, we need to move far, but we also all need to move together. This is the first international conference on NTD in Africa, and I believe that it highlights a positive move towards African ownership of many of the complex issues that the continent faces in light of the fight against NTDs. Through the roadmap, we are trying to go further than we have ever gone before and to achieve sustainably as a group of countries more than we have ever attempted to do before. This is our task, no more, no less. Our continent has the capacity, has the expertise, and the desire to control and eliminate NTDs. This I know from my own long experience working on the continent. I believe also that we'll develop together the collaborative and cross-border initiatives and partnerships that will enable us to bring us to this vision. So it is with courage and optimism and faith that I invite us to pursue the collaborations that we need and to take advantage of this historic opportunity to work with our friends and our neighbors for the good of our country, our region, and our continent. Thank you and enjoy these few productive days. Asante sana, ninawashukuru. Asanteni.